This slideshow will help you not only for exam, rather in your general practice also. Though we are highlighting the exam in here, this is the simple mark sheet. Simple mark sheet. 4 skills are there. We will not discuss today too much. It is for your excitement given. And this is the name and other. But regarding the hypertension, this is an introduction, greet and meet part. I am not here now to guide you to the directly relevant with your hypertension patient. This is the important history and symptom issue. So may I request anyone to tell one by one, every and each point is important for evaluation of the hypertensive patient. Who want to read with me, please? Anybody can help. Dr. Javed always helping, and any other colleague? Because if you read more, it will be more inbuilt in your brain, doctor. For that, I am proposing to you. I can read, no problem. Dr. Javed, please.
Sure. First point, ask about headache,
And visual symptom.
visual symptom, shortness of breath. Yes.
Visual
Chest
symptom.
pain,
Why
breath.
I am giving you, examiner usually prepare the checklist. It is called the calibration also. With these issues, it is not usually open. We actually tried to get it out from the sources from the internet, how a checklist could be designed for hypertension station. So each and every point important. So go through, Dr. Javed, again. In the
Uh,
history part, mandatorily you need to ask this thing one by one, please.
okay. Next will be chest pain, shortness of breath,
Breath.
then dizziness, syncope, then duration of raised BP.
Yes. If you miss any point, you will lose the marks. The next slide. Next slide. Current patient position in
Task,
the measurement during the measurement of the blood pressure. Many,
correct,
many points are there, but these points should not be missed. Correct position should be there. Then,
correct cuff size of the BP apparatus, both
yes,
arms checked,
both
repeat.
arm checked. Fast visit. This is a mandatory in the fast visit.
Okay.
Then,
And repeat measurement taken. Explain need for ambulatory blood pressure and home-based blood pressure monitoring.
yes, if it's a very new patient, you are diagnosing the high blood pressure for the first time. Everything should be done. But my tricky question, anybody can reply. If you get the blood pressure difference in the right arm and the left arm, there is a difference. So in the subsequent visit, where will you measure the blood pressure, in the right or left?
The one which is higher,
Yes, the one which is higher. Very right answer. Dr. Javed, by the mercy of Almighty, try to appear in the OSCE in future.
inshallah.
Inshallah. The next one, recognition of the red flag points.
I will
Chest
continue.
pain? Yes, yes, please. Other colleagues are silent.
Uh, Chest pain, first
Okay.
point. Then
Okay.
CNS deficit, visual
Neurologic deficit,
neurological
visual
deficit,
disturbance. Okay.
visual disturbance, pulmonary edema, hypertensive emergency, urgent referral stated.
Or not. If it is hypertensive emergency or other issues, that means if you get red flags, usually patient needs to be referred. Okay, doctor. So a little further discussion needed here in this point. Somebody thinking that South Asian or ski, they don't approve referral. But it is not absolutely, it is not 100% true. Wherever referral needed, especially for the red flag, how a GP can help the patient completely? Red flag usually in general, red flag needs referral. So we need to show the pathway there. For this, urgent referral stated that did we refer or not. It is very clinically very true information. So don't be biased by any talk that referral is prohibited in the OSCE. But it is not like our Western pattern. Western country referral is very easy, but our South Asian referral is difficult. But wherever needed, we will try our best to do it. So these things should be checked. Without checking these, it is called unsafe doctor. So unsafe doctor shouldn't pass in the OSCE. So everybody today, we will try to be a safe doctor by asking the red flag. Okay, then in the examination skill, Dr. Javed,
Uh,
examination.
Examination, pulse assessed, cardiovascular examination mentioned, fundoscopy mentioned, peripheral pulses checked, body mass index and waist circumference checked.
It is the area usually we miss. Could be, right? BMI? Because we don't do it in our chamber. Dr. Javed, what do you think?
Yes, yes, we are not doing.
Normally, we are not doing. So, it's very extraordinary information here to share with you. Other thing written as mentioned. Why? Because you don't need to examine the whole precordium sometime. Okay? But you need to say, I like to examine the chest. Oh, sorry, I like to examine your heart, rather to say.
Excuse
For
me,
this reason,
Usman, can I ask something? So
please.
the sequence can be changed because here, like you said, pulse, CVS, peripheral pulses. Because if I will do pulse, CVS, peripheral pulses, body mass, and fundoscopy in the end.
Its sequence is not important.
Okay.
How you can make a good sequence already we discussed in our focused examination skill in the
So we can
OSCE.
reshuffle the
Yes,
se-
yes, yes, doctor. If you have
all.
time, you can see the YouTube video. It is open for all. Recently, we uploaded there the focused examination skill in the OSCE. We discussed detail there how to make the examination plan easier. Okay.
Okay, thank
Thank
you.
you. The examination skill then investigation suggested. In the hypertensive patient, these investigations should not be missed. Let me read Dr. Javed on behalf of you. Urine SER, albumin creatinine ratio. Usually we don't do it, maybe due to the money issue, monetary issue. Urea and electrolyte with the creatinine including eGFR. Okay. It will be very fantastic if you mention that I will calculate eGFR. It is a matter of calculation. So only creatinine electrolyte will not be enough. I think we have to include electrolyte also here. But electrolyte, sorry, included there. U and E. E means electrolyte, renal function. Then fasting glucose, okay, HbA1c. You could add here 2 hour after 75-gram glucose drink. It is the best screening test. It will be very best screening test. But as a follow-up patient, if patient have the diabetes, definitely hemoglobin A1C should be there. Lipid profile and ECG. These are mandatory investigation to be done for each and every patient of hypertension. Dr. Jabed, next point for you. 7, management plan.
Yeah. Yes. First point, lifestyle advice
Given.
given,
Hmm.
salt reduction, weight management, drug classes correctly stated, ACE inhibitor ARB mentioned, calcium channel blocker mentioned, diuretic mentioned.
Mention means if you try to or if you select the ARB for the patient, you explain to the patient, I am giving this medicine, it is called ARB or ACE inhibitor. Because in the first time, for first visit, we may not give each and every medication. If patient try to or wants to ask about the medicines available, then we can give a lecture. But in the OSCE station, usually in the practical point of view, you will not have enough time to say to give a big lecture there. It is also true. But keep in your mind, this will be the checklist. Some points definitely should be there, especially lifestyle issue should not be missed. Next point, Dr. Javed.
Yes, no, safety points.
Yes.
Pregnancy contraindication, ACE inhibitor cuff explained, spironolactone for resistant hypertension, monitoring U and E after ACE inhibitor.
This is the case to case variable, right? If you don't start AC inhibitor, so no need to mention the urea electrolyte after few days, isn't it? So according to the case, you must include it. If you are dealing a pregnancy patient, definitely contraindication of the drug should be said there. So in the mark sheet, examiner actually have a hidden information like this. Now, ninth point, communication and patient education.
I will continue, Dr.
Yes,
Usman.
yes, yes, doctor.
Used simple language, explained silent nature of disease, shared decision making, empathy shown, patient questions invited.
If anybody doesn't understand any point, immediately raise the hand and ask. Open the mic. This is very crucial and vital part of consultation. I hope all of you understood. If you want to, especially any new colleague, again advising you to go our YouTube. These skills, this skill, how to show empathy, okay, the avoid the jargons. Okay, shared decision making we discussed there. Safety netting and closing. Final slide, Dr. Javed.
Yes. Uh, Task warned about red flag symptoms. Give clear follow-up advice. Check patient understanding. Thank patient closed properly.
Properly. All points should be there in your consultation. Safety netting and closing. Actually, for each and every symptom. So we are dealing with the hypertension. So if you're not done, your score will be less. If you have done it, then you will get the question. And finally, last part of your mark sheet, examiner will give you a pass mark, borderline, and fail. Possibly it is not the final decision. They will calculate and gather, make a complicated, maybe digital summary of your score. But examiner who is in the station, they will give you pass mark, borderline, and fail. And usually examiner should comment here why examiner have given the pass mark there. It is called the overall assessment. Those who appeared before with the OSCE, you have seen it. And in future also anybody, if anybody interested, you can come with us. We will show you what will be the detail. Okay, doctor, any query? Any query about this until now? INJ, I'm sorry, I cannot utter your name. Doctor, do you like to say anything? No more. I think we like to close now our session.